Healthcare in India, rarely an election issue despite limited access. Yet they rarely become a political issue. However, it would be a mistake to imagine that citizens do not care about health facilities. In India, health related public policies and healthcare infrastructure have often been a matter of discussion among policymakers, yet they rarely become political issue. However, it would be a mistake to imagine that citizens do not care about health facilities. Years before the ongoing pandemic drew attention to this issue, a study, State of Democracy in South Asia, Round 3 by Lokniti CSDS in 2019 found that people expect the government to take maximum responsibility for providing basic medical care. But when it comes to voting, health never becomes an electoral issue for voters. Nor do political parties generally focuses on health infrastructure in their manifesto or campaigning. Health in elections. In the several rounds of post-election studies by Lokniti CSDS, less than 1% of voters have said health was their consideration while voting. It was assumed that during the current pandemic, voters would prioritize health as an election issue. But this has not been the case. The Bihar Assembly elections were held just after the first wave of COVID 19. During the post election survey, less than 1% of voters considered health an issue, while voting, which was not very different from the findings of the last post election survey in Bihar. In early 2021, when India faced the second wave, elections were held in 4 states. Here, too, less than 1% of the voters considered health an election issue. Access to healthcare. In the SDSA 2019, the enumerators were asked to observe the availability of medical facility in the surveyed location. It was found that 70% of the locations have public healthcare services. The availability was less in rural areas compared to urban areas. The enumerators were also asked to survey whether people can reach health care facility by walking or need to use transport. In the 45% of the surveyed location, people could access health care services by walking, whereas 43% of the locations they needed to use transport. Proximity to healthcare services is higher in urban localities. 64% of the enumerators in urban areas observed that people can access healthcare services by walking, while only 37% in rural areas can do so. Public health experience. In a study conducted between elections by Lokniti CSDS in collaboration with Azim Premji University during 2016-19, 30% of the surveyed people shared negative experiences in availing public health care services. It was more so for people from the marginal sections who avoid getting treated, sometimes due to lack of infrastructural and monetary resources. In the State of the Nation survey conducted in 2018 by Lokniti CSDS, people were asked if they have ever taken a loan for medical treatment. 1/4, 25% confirmed taking a loan, and this proportion is higher among people belonging to the scheduled caste and the poor. Scarcity of funds further discouraged them from taking medical treatments. 43% of the respondents said they or someone in their family went without medical treatment. This trend was mainly observed among people from scheduled caste and scheduled tribes. More than half the respondents in the section said so. At the same time, 47% of people living in rural areas said that they went without treatment. These findings indicate that the healthcare system in India needs to be made accessible to the needy and people living on the margins of society. The absence of a positive experience with public healthcare not only pushes people towards private healthcare facilities but also the issue of health out of public political considerations. Thank you.